Dr. Summer Knight, she's an innovation catalyst expert, successfully founding, rapidly scaling, and profitably selling companies in health, IT, education, international security, and in real estate. She is an experienced Fortune 100 national medical executive and innovation expert. Her bio is on the app here, and I encourage everybody to read that. It's just a great read, and I'm not going to go into it at all right now, but she's been a chief medical officer for the state of Florida. She's been an innovator and entrepreneur, as I mentioned earlier, a known author and advocate for the youth. She's a nationally known speaker on television. And for years, she's been at the crossroads of health, innovation, service, and advocacy. Easy for me to say. So please join me in giving a warm welcome to Dr. Summer Knight.
Well, good afternoon. This has been a wonderful conference. Just want to take a moment first to thank CableLabs for putting on this great conference and really beginning to focus on healthcare. I think it's really needed, and you're going to hear through my remarks personal and professional request for Cable to get even more involved in healthcare. To start out with, I just wanted to share a little bit about why I'm so passionate. Was just introduced, I don't only have a 360 experience around healthcare, I actually call it a 720, so I'll share what I mean by that. So professionally, I have been able to be the Chief Medical Officer for the state of Florida. And what exactly does that mean? That means that it's overseeing population health to the tune of 2.8 million individuals, but it's also to safeguard the stakeholders of that system, which is called the voters, and the spending power of about $14 billion. So that's truly population health issues. Also been able to be a Fortune 100 executive working for Cigna as their national medical executive, helping large Fortune 100 and 500 companies really think through their population health issues as well, and true impacts. So what are the impacts of chronic conditions, catastrophic conditions, and then also at Aetna as their strategic head of all of their digital health brands. So they had put 13 digital health brands into a company called Healthogen. Some of you guys might remember that organization. And I came forward and helped them in understanding how to bring those brands into the marketplace. And then as a visionary CEO, so I have started up a number of early stage companies in digital health, oftentimes in areas where people have said, we can't solve this problem. And so, for example, we were dealing with a rather significant issue in healthcare, in Medicaid, where people were unable to be kept in their homes. And the fraud and abuse that was occurring was so significant that the legislator wanted to shut down that project. And what we ended up doing is actually bringing in technology to solve these issues. And at the time, it was thought to be cutting edge technology, which is now today, about 10 years later, is actually the standard of care in healthcare around community care. On the flip side, and much more personal, is that I am a physician and also a patient. So I have survived, I've conquered cancer and gotten through that. And then I think even more meaningful for me, the worst thing people say that you can hear in your life is you have cancer. And it's not the worst thing that you can hear in your life. And that's actually that someone that you care for has cancer. So I'm a sandwich generation caregiver. I take care of an elderly person that lives in our home, as well as a child who is a member of our family. So I'd like to go through, and what I would like to go through today, if you'll have the patience with me, is really a story about how we can humanize healthcare together. Our healthcare deals with human beings, but we deal with the bodies of human beings, and oftentimes we forget about the emotional, the behavioral, and the spiritual side of humans. And so actually I think that we've been on a trajectory of dehumanizing healthcare over the past several years. And you'll hear from my remarks that I believe that although electronic health records, I feel, has separated physicians from their patients, which I call our clients, that there are digital health tools that, and I remember Simon had said that we needed to think about a portfolio of digital solutions to help that doctor-patient relationship, and that there's a portfolio of tools that can help to rehumanize healthcare. I wanted to speak a little bit about the different terms we've been throwing around today, which is connected health versus virtual health, and also that there is a huge opportunity for cable. And so you're going to hear in my remarks the war cry for cable. Join us. Get into healthcare because we desperately need your support. You have laid the infrastructure foundation that we need to ride the rails on. And I'm really super impressed with what organizations such as C4MI are doing to bring these issues to the forefront, and also impressed at the partnership that CableLabs has made with them to make that a successful endeavor in the future. And I'll round that off with a specific case to just give you a small glimpse into the impact that you can have on your own businesses by engaging in healthcare, a doable use case. So with that, I'm going to start with a story. So this is Nicholas, and Nicholas is a kid that you're going to see in your neighborhood, running around, vibrant kid. He's kind of like the Pied Piper. He's the kid who, when you're trying to struggle in the house with your groceries, he's going to go and grab an extra bag and hold the door open. He's the kid who, is pretty good in school but awesome in sports, so all the guys want to hang out with him. And when Nicholas had his 13-year-old birthday, his gift was that it was the gift of cancer. And so all of a sudden, this vibrant young man had to receive information that he is going to be treated and that he's to spend the next 8 months in hospital jail. And you can imagine taking this child who's running around all the time and putting him in hospital jail can be quite a significant sentence for him. So this is Nicholas's mom. She's a working mom. She's trying to juggle all of the other things that happen in life. And how many of you already feel like your life's pretty maxed out, that you cannot do one more thing? Put your hands up higher, because I know this is 100%, right? So so think about this. For Nicholas's mom, all of a sudden, she's handling this entire world that's going on, and then add on to that a complex condition of one that she loves so much. So what Nicholas's mom realizes is that this is going to take a village. So she begins to orchestrate. And how do we make the home team part of the health team? How does one person be able to get the things done, right? So working mom has the honey-do list is going to grow, got to get the groceries, got to get the car gassed up. And how is she going to manage that? What she realizes that she can lean on her natural support network of family, friends, and volunteers. Because when somebody hears that somebody else is ill or has a chronic condition, people want to help. It's just that they don't know how. And there's not a really good situation or platform that allows those of us to help others. So just from, again, a show of hands, think about somebody in your life. It could be yourself. It could be a family member. It could be just someone you're fond of in your community. Think about who might be struggling with a complex or chronic condition, and just by show of hands, who wants to help that person in your community? And put your hands up high, because you should be proud of that. Great. Now, I want to see another hands of who knows how to help that person, and have you been able to? So do you actually have a direct route of knowing exactly what you can do to help that individual out? If you'll just put your hand out. Thank you so much. So I just want to share that everyone in the audience has said that they know of somebody, but only 4 people put up their hand, me included, of saying that they knew exactly how they can help. Isn't that amazing? We have a passionate, no-cost workforce that's just waiting to help out, that is not getting leveraged. So that's what Nicholas's mom realized. So she realized it takes a village, and sometimes trying to take care of the other kids, Nicholas's mom would have to tap on the village. And in this situation, here's a friend, Mildred, who is taking Nicholas over to the clinic, and mom's going to meet them there. But she just couldn't seem to facilitate that car ride in. I mentioned that this is an 8-month sentence for this chronic condition, and that's because Nicholas now needs to have chemo. And so what the family realized that they would do is that they wanted to be able to decrease the amount of time that Nicholas would need to be in the hospital. And their goal was to shift it from 8 months to 8 weeks. So how would they do that? So they went about being severe advocates for their kids, not just advocates, but severe advocates, almost to the point of alienating the rest of the healthcare partners. And they worked with their providers to be able to have virtual interactions with the providers, such as having televideo conferences and phone calls, et cetera. And then also being able to use different equipment that could be information could be remotely brought to the healthcare system. Now, this wasn't a usual process. The doctors were not actually quite thrilled about this process, but it worked. So I just want to share with you that this is actually a story about my son, Nicholas, who is 13 years old and is in the middle of his treatment, and how we have been able to shift from living in the hospital for 8 months to actually living most of the time at home, giving a really difficult treatment of chemotherapeutics, a complex condition. But let me share with you that this is because I'm a doctor that I've been able to do this. And it hasn't been easy. So I was sharing with Dr. Kaus, who did a great presentation earlier today. If you missed it, it was something that you should look at the video and share with him that in the course of taking care of Nicholas, even though I'm a physician, there are so many medications that we had to deal with. Now take this situation and put it into the aging in place population, which we're going to talk about in just a little bit, right? So here is a mom, very passionate, who's a doctor taking care of a child. And in this amount of time, I'm embarrassed to have to say, I've made 3 major medication mistakes at home for my kid. Serious mistakes. One of them was as simple as I had 2 medication bottles sitting there. I knew one was for Nicholas to take, one was not to take right now. One of my other children came in as I'm talking. I screwed open the bottle, gave him the medication. As he's swallowing it, I realized I just gave him the wrong medication. So if I'm making these mistakes at home, what are families doing if they don't have the connectivity with the healthcare system to be able to ask questions, to get support, et cetera? So this is a big issue. However, healthcare is moving out of the hospitals. There are some innovative CEOs of healthcare systems that are saying, you're not going to see cranes above my healthcare system any longer. We know that we have to move care outside of the hospital, that we're going to have to become a virtual healthcare system. I fully support this because I believe that when we take this leap, that we're going to begin to humanize healthcare. And what do I mean by that? I mean that we're going to be able to engage and empower individuals and their families as part of the healthcare team. So you'll hear me say this a few times. Let's make the home team part of the healthcare team. Because again, we're leveraging that passionate, no-cost workforce that is there to help the patients and really augment the healthcare system. And think about the, not millions, but probably billions of dollars that we're going to save doing this. And I'm going to show you where those numbers actually come from. So humanizing healthcare means hardwiring humanity into every step of care. That's pretty significant, but what does that give us? That gives us an opportunity to really engage with not only that client, that individual. You'll see I try and move away from the term patient because none of us want to be called a patient, right? I want my doctor to think of me as his customer or her client. I don't want to be a patient. That's a disabling kind of term, right? But also remember that people who are sick or injured are probably not in the best situation to make critical decisions. That's where I have a huge fight with HIPAA and thoughts around how to work with it. Because, and this is why I talk about the community of care, is that oftentimes, I know, think about times where you've been sick with the flu. It's really hard to go forward and do the work that you would normally do in your workday. Most people are, huddled under the covers. They don't want anyone to bother them, right? Let alone trying to enter into an entirely new environment and get fed totally new information and try to make decisions on body systems, et cetera, that you have no prior experience with. That's what we're asking when we talk about engaging patients and getting them committed to make decisions in their own healthcare. It's extremely difficult. So what I like to think about is really engaging that community of care. So by engaging that community, we're really able to begin to share information with the patients and with their caregivers. So you'll hear that a lot from me. And also being able to address the social needs of individuals as well as their emotional needs and their healthcare needs. So in my example with Nicholas, the reason why we realized that we had to go virtual is because in a very short amount of time, and I'm going to guess that this happens to most patients who go in the hospital, if you have to be there for any amount of time, you become a prisoner of the room. And so let me just ask another show of hands, is that who has actually been a patient in a hospital for more than a week? Thank you very much for being brave to share. Who knows of somebody or cares for somebody who's been a patient in the hospital for more than a week? Thank you for sharing. That's about 3/4 of the room. It is one of the toughest things that you'll have to live through. It's demoralizing. What happens is they attach you to different leads, different sensors, to IV therapy, and you can't do anything without your friend the pole. Then if you're not feeding very well, they put a tube in to feed you, so you got a tube through your nose or a tube through your belly, so you can't move anywhere without that other pole. Have you ever tried to go to the restroom when you're holding 2 poles? None of us do that. It's really difficult. So Nicholas was really struggling with this, and at one point he was so upset that I asked the nurses, can you just take him off everything and just give us 3 hours? And so they did, and we went AMA, and we went and took a little ride, and I'll tell you what that did for him. He remembered what it was like to be outside the hospital. And his counts weren't coming up, and when we came back, within 2 days his blood cell counts were coming up, and I'm sure that's because he remembered what it was like to be on the outside. And that's when we were motivated to move him forward and move him through. So that's when I'm talking about humanizing healthcare. The problem in healthcare, you're going to hear a lot about this, fraud, abuse, waste, et cetera. The real problem in healthcare, from my opinion, is lack of integration. And I'm not talking about integration of the primary care doctors with the specialists or with the ER, with the in-hospital doctors, or with the primary care out in the community. I'm actually talking about the key stakeholders. So that's that individual client of healthcare. It's their family and friends and volunteers. It's the community that can be motivated to move forward. I want to transition and just talk about connected health and virtual health, because we use those terms interchangeably. So connected health, so what exactly is connected health? Connected health is how we do it. Virtual health is what we do. So here's what I mean. Virtual health is when you have an interaction between the healthcare system and that healthcare consumer that's remote from being together, right? So it could be a face-to-face, but think about a televideo conference. That would be an example of a virtual healthcare interaction, and the tool is the connected health piece of that. So with virtual healthcare, it's this remote communication that can help to lead to a diagnosis, treatment, monitoring of care. It's the things that we do to interact with an individual, but we're just not in person. By the way, virtual healthcare has been happening for a very long period of time. So it's been happening as long as definitely where the telephone is. I've been doing virtual health all of my career, because I'll have that biopsy from somebody worried about what is that going to share, and it's Friday and I just got it across my desk, and I'm going to pick up that phone, I'm going to call and say, Mr. Smith, I have good news. You can rest for the weekend. Your biopsy is negative. So that's what virtual health is, and we doctors have been doing it our entire career. So for virtual health, this enhances access as we move further and further down the spectrum. It also helps because it's convenient, right? So moms are able to get their children diagnosed without having to get them from school and escort them into the clinic. People are able to stay at work and get their issues taken care of on a monitor between a doctor and themselves. So there's so many things that happen with the virtual healthcare. And by the way, it's also cost effective. We're seeing that employers are driving virtual healthcare much faster than the healthcare industry is doing. And as I mentioned, connected health is how we do it. So that's the infrastructure, and that's why we're here today talking about connected health, because it's driving off of the infrastructure that you all have built, your hardware, your software, and all of your connections. You'll know I'm a doctor, I'm not a technician, so you're not going to get any of those comments. So oftentimes when we're asked by a healthcare system or health plan to come in and chat, we're asked to deal with about 3 or 4 major issues. One of them is, how do we create a virtual healthcare system? So help us to understand, what does a plug-and-play solution look like? The second one is, well, why? Because we always ask, well, why do you want to do that? And they say, well, we need to be able to have a consumer engagement situation. And then lastly is that they want to streamline their care triage, care coordination, and care management solutions. So I wanted to delve into that a little bit, because we're seeing all of these companies coming out, these startups that are offering, and large corporations pivoting, that are offering televideo, that are offering remote patient monitoring. We've been talking about that a lot. But I think what is lost is that consumer engagement and community activation. And so whenever we're speaking with a healthcare system, we're always suggesting that they first put the patient in the middle of all decisions that they make around virtual healthcare, right? Because we know people are mobile, or people tend to have certain behaviors. I was listening with the panel discussion Mark Francisco was on, and one of the things he shared was how they're beginning to look at the social aspects of someone's life through what they're using, what they're viewing on the television, maybe how they're dialing up and dialing down their thermostat. And those types of social indicators can be very helpful when we're dealing with the aging in place and the intersection with healthcare. So we say, start out with a consumer engagement solution, and then add those tools that help to augment that access through virtual healthcare. So what does that mean? It means, frankly, care delivery transformation. And there is a lot of excitement about that for the future. There's also resistance, because it means making shifts in the way business is conducted today in clinical care. So both the actual business activity, but also the way that we clinically interact with other human beings. So imagine this as a future of healthcare, where the individual consumer, so let's say, for example, my 95-year-old grandmother, actually is able to be engaged, not episodic as this currently happens, but in a contiguous situation, because she has her monitoring devices. But not only that, but she is connected through a consumer engagement platform. So who cares most about how grandma's doing? Do you think it's her doctor? Probably not. I'm gonna be honest. It's gonna be her grandkids, it's gonna be her sons and daughters, it's gonna be her sisters, it's gonna be her friends. And when we're able to see what's going on with grandma and be able to see some of her health indicators, we actually are going to be more proactive in working with the healthcare system to help to intervene and make changes. Just this simple interaction with using devices and getting the community involved is going to save about over $200 billion. And I'm going to show you the math for that pretty soon. So, activating a natural support network of family, friends, and volunteers, and then being able to use the remote patient monitoring with telemedicine, care triage and coordination, and care management. This is where I think the big business model is changing. I mentioned I used to work over at Cigna and Aetna, some of the largest payers in the country, and when they started to look at care delivery transformation, everyone realized, aha, we can use a fairly low-cost clinician to be able to help families to be effective, and that would be a care coordinator. So someone just simply to be able to say, well, I understand that you have an issue with grandma. You can take this specimen over to the lab, and then the doctor can call you back and tell you whether or not she has an infection or not. So just amazing ways of shortcutting the entire process. And of course, we want to have that data. Oh, am I cost? Our data for exchange and analytics, because we're not wanting to rely totally on the family, right, with all this data. And then connecting all of that so that we have one large connected system to help grandma. And by the way, folks, there's 175 million grandmas out there for us to be supporting. Let me just share with you a video on how this can help in aging in place and how healthcare is beginning to think and strategize on how they can wedge. I was just meeting with a CEO in my town, and he runs 6 different hospitals, and he had asked us to come in, and he said, we don't get paid for aging in place solutions, but we see this as the biggest issue in our healthcare ecosystem, and so we're trying to plug in different ways of being able to help our aging population. And so we created this video to share with him, and so we just wanted to share it with you quickly.
That surrounds your loved one with the care needed to maintain independence, leveraging a community approach. Care Village not only connects the natural support network of family, friends, and volunteers, but includes professionals, such as your Care Village coordinator, who makes caregiving a satisfying experience to help mom maintain her independence in a proactive and safe manner. Through its connectivity to the local hospital, mom's doctors can provide care in the comfort of her home, share information, and answer questions with the rest of Mom's Care Village. Living in one's own home is important to quality of life. Therefore, Care Village brings together other service providers who are experts in helping individuals maintain their independence.
So this was an example of how the healthcare system can really begin to impact aging in place and some of the big issues that are occurring. So let me bring this around to cable. So one of the things that we were identifying is that in order to really, and we've heard the word trust quite a bit in this room, is to really create trust with healthcare, is that we constantly hear, hey, we're unsure if we really want to make that connection from our institution into the home. So we need to have a trusted medical grade connectivity. So we went about trying to define that, and we define that as having a secure connection between providers and, let's say, for example, the medical grade devices in the home that really includes that authentication, data encryption, and management of the connection. So what would that do for the healthcare system if we had that trusted connection to health? It would actually allow for a true continuum of care. So rather than the episodic care of an individual walking into their doctor's office or the emergency room or the hospital, which is very episodic, they could actually create a continuous relationship where that individual is always connected. Data is always coming through. There's a contiguous personal health record that's being developed and kept. As well, that you're able to unite and empower that individual and their natural support network of family, friends, and volunteers. So that allows you to enhance healthfulness. So when you're impacting healthfulness, did you know that people with chronic or complex conditions can actually optimize their healthfulness? So people can do things to be as healthy as they can be, even if they're impacted by a chronic condition. And when you get the family involved and they understand how to help their loved one, they are. I mean, how many of you have ever said to an aging parent, hey, Ma, Dad, take your medicine, let's go walk around the block, let's get some exercise, and seeing them more motivated just because you're kind of nagging at them. It also allows for easy data flow and therefore earlier intervention. I was sharing with another individual earlier today that, that we actually thwarted using these consumer engagement tools, an issue for my grandmother that would have taken her into the hospital, probably the ICU, because the elderly can very quickly become disabled with an infection. But because one of my family members noticed the behavior that was happening with her kind of early on and just messaged, hey, isn't this odd, blah, blah, blah. The rest of us kind of put our heads together and realized that it wasn't that grandma was acting weird, it was actually that she probably had an infection and we're able to intervene quickly. It leads to more efficient use of the healthcare resources as well as to better access, and then also to be able to have flexible engagements that work for both the consumer and for the healthcare system. So, what do we mean when we say connectivity? For healthcare, what we're talking about is we're talking about using the enablement of infrastructure and tools like platforms and applications to be able to engage the consumer and their natural support network of family, friends, and volunteers. So maybe our definition is very different than the technology definition, but that's kind of the doctor definition of connectivity. So to delve into this a little further is to better understand the future of healthcare. So in the future of healthcare, it will be provided on a value-based model. Right now, healthcare is provided on what's called a fee-for-service model, which is a transactional model. So basically, I, as a doctor, am rewarded for you being sicker and sicker. Obviously, I have a do no harm clause in my education, so I'm not working on making you sicker, but you understand what I'm trying to say. There is no reward to me and any of my colleagues for your healthfulness, quite honestly. So when we move to this value-based model and the reimbursement changes, we actually are more and more rewarded for you being healthier. So we're going to put in place and rewarded for using things like remote patient monitoring and knowing ahead of time when you're going to have issues. We also have to begin to treat people on a population health level, but get all the way down to your individual preferences for care. And that's huge because that requires a huge amount of data and analytics, and then getting all the way down to that treating physician and that client relationship. We're going to be coupling the physical health with the social situation. That scares healthcare systems to no end. And you're going to see, we actually interviewed over 100 healthcare executives and really sharing with them what cable could do. And in their list, one of the biggest issues that they wanted help with was how can they access some of the social data and coupling that up with the healthcare data to better be able to solve patient issues. That remote health monitoring and remote interactions are going to be more the norm than the unusual, and that patients and their families will receive information when, where, and how they need it at the right time. And this is interesting because we in healthcare don't know how to curate content. And so we don't know how to send specific patient information over to the individual and possibly send information to the caregiver or that circle to be able to put it in their terms so that they know how to help. For example, if I have diabetes, how can I alert the rest of my personal network how to help me out with my diabetes? How to notice, because if my blood sugar is going low, I might not notice that I'm getting irritable or that I'm thinking, my thinking isn't clear. But the people in my environment might, and if they're given the correct content and information and knowledge, then they can intervene. So to realize the future vision of healthcare, organizations are going to have to transition from this fee-for-service model into the value-based reimbursement model. They're also going to have to severely augment this consumerization of healthcare. This is not their space. This is not their space at all. They're going to have to create integration between all of the stakeholders for that individual's care and create actionable data. They're going to have to integrate that social and the health information, as well as being able to address healthcare populations. This is why you're hearing the drumbeats from healthcare that they need assistance, because each and every of these 6 items they haven't been doing in the past. So here's what healthcare needs from you. They need reliable platforms that securely connect the healthcare businesses with the consumer homes in the future. If I didn't mention it, the tipping point for going from value-based to fee-for-service was originally thought to be 2018. It's been pushed back to probably more like 2019, 2020, but it's already pervasive. So there's already bundled payment programs, et cetera, that are going on. There's already healthcare systems that are fully at risk. There's Intermountain, there's Geisinger, Kaiser, and I think we've also heard of with some systems that have their own health plans. They have to have the ability to scale. They need to be able to have engaging content delivered to their communities. They need tools that help them to coordinate care and management, as well as easy-to-use e-health health solutions. And what they really need is they need partnerships to transition from this capital-intensive cost to more of a service model. And I'll give you an example of that. We had a very we had a client who was a very forward-looking CEO in healthcare, and he was brought in by the board to make sweeping changes in they were one of the largest regional healthcare systems in their area of the country. And he had said, you know what, we're gonna put in telehealth, and every single doctor in our system is gonna have at least 1 televideo visit per month. This sent a rippling effect through all of the docs, as you can imagine. I kind of thought, hey, there's some docs I don't really want to see on televideo, but that was an aside. And then they proceeded to fulfill that promise, which meant that they had to invest millions and millions of dollars ahead of the curve to actually make that happen. And so then later on, we had them meet with their local cable operator, and their cable operator shared that if they had actually used their solutions, that they could have actually just paid on a monthly basis and didn't need to put that huge capital expense. So that was the aha for this healthcare CEO, how important it was to leverage the infrastructure and the strategic partnership with the cable industry. So critical to healthcare industry that cable operators become involved. And here's my big plea for all of you as we go through this. I told you that we interviewed 100 healthcare executives, and we brought with them a list of the value propositions that cable operators had to offer. And we shared with them that not every cable operator is going to have all of these, but most of them have some of these value propositions. And we went through with them this, and here's what we got back. These executives said that they would prefer to go to their cable operator, who they already have a relationship with, than to other vendors in order to do the following things. One is to leverage their technology platforms and infrastructure that's already in place to being able to transition into virtual care of some type. Number 2, they needed guidance and partnership. Remember, some of these healthcare systems don't have a technology infrastructure or even a team to support. So they really rely on their vendor partners, and so they needed some influence around big data management. That they desperately needed help to understand how to use content, how to deliver it, how to create it, how to curate it. They also needed help around connection between the provider and the home, because they felt that that was the next frontier in healthcare and in care delivery. They needed help with service logistics. They said, hey, you already are going out to people's homes. If we begin to send people home with devices, can we learn from the way that you service the home? And then also call center capabilities. That was just a little wish list. So I'd like to delve in for the rest of the talk about why cable can win. And remind you of our definition, right, is the trust factor. Can you supply healthcare with a medical grade connectivity? And that's a secure connection between the providers as they move out into the community even further into virtual care, and assure that we're getting a trusted solution such as authentication, data encryption, and management of the connection. And that's what I'm hearing in this room today, so I'm pretty excited. So in the healthcare ecosystem, what they're hoping that medical grade connectivity would provide for them is security along the entire continuum. So we talked about devices, and we hear what C4MI is trying to do around standardization of those devices. But we also want to make sure the Wi-Fi is secure, that the secure connection from the home all the way to the healthcare systems. They need to make sure it's scalable. They don't have that capability. And this direct connection into the home, and then also quality of services. So they wanted to rely on the cable industry for their video and audio capabilities. So let's go into this from a use case perspective on what this could mean for cable, right? Where you don't want to necessarily create non-for-profits to help out healthcare. So if we look at a use case of remote patient monitoring and think about the medical grade connectivity as the foundation, what we're able to offer healthcare could be very interesting. A little bit into chronic conditions, I wanted to define this. So chronic conditions are diseases that last over 3 months and usually continue on for the rest of most people's lives unless they really seem to get their stuff together and do the social things that they need to do to change those conditions. So they're generally progressive. They are the major cause of disability and death globally. So these are your heart disease, your stroke, your diabetes, your pulmonary problems, your lung problems. Interestingly enough, 80% of all healthcare spend occurs on chronic conditions, and this is where you're able to impact care. Right now, the standard of care is generally a patient who is monitoring their own indices. So yeah, you do walk through the physician's doors, and they might take your blood pressure, test your blood sugars, go get some labs, take your pulse, take your oxygen level. But generally, for most chronic conditions, it's self-recording. And as a receiving doctor, I can share with you that I am lucky if I get a bunch of loose pieces of paper that have been ripped out of someone's booklet, because usually people show up at my office and they've forgotten their log, or they've forgotten to log. Nowadays, we're looking at those people who have embraced their smartphones will start to put their data on those, and so we have a little bit better data that's coming through. However, when we couple remote patient monitoring, we get better results. So just for those in the room, we've been talking about remote patient monitoring. I wanted to throw up a few of the devices that you can consider for remote patient monitoring, like blood pressure cuffs, weight scales, et cetera. There was a study done by Geneva that had stated that they were saving $8,375 per patient from using remote patient monitoring, which is a significant amount every single year. And they measured this against avoidance of emergency room visits and hospitalization, and also managing what's called transitions of care. So what that means is oftentimes over 10% of our spend occurs from people who are in the hospital. They go home, they probably don't take their medications the way they were supposed to, and they end up right back in the hospital again. And these are generally avoidable, and healthcare systems actually get fined for these patients coming back. They found that by using remote patient monitoring that this was actually a low number. The number is actually between $8,000 to $13,000 that they could save per patient per year using remote patient monitoring in certain populations. However, there's two main obstacles to this. One is the payment models right now, which are shifting in 2018, 2019, and 2020 to value-based. So that obstacle is getting out of our way. The second one is the medical grade security, the trust factor of using these tools and relying on these tools in healthcare. So what does this opportunity look for cable operators? We worked with CableLabs to really begin to investigate that number and delve into what this meant. So I wanted to share with you how we began to look at this problem. From a healthcare spend, we spent over $1.1 trillion on direct costs to treat chronic conditions. You saw that 80% on the map. Of that, $400 billion of that occurs in the emergency room or in the hospital. And I mentioned earlier is that 10% of that is from people bouncing out of the hospital, back to their home, or to a nursing home, or to another facility, and back into the hospital. It's a tremendous amount of money. What research has shown is that if we could leverage remote patient monitoring, that we would save our system $205 billion. We can do a lot with that money just by using remote patient monitoring. In addition, besides that $205 billion, hospitals are right now paying about $528 million in penalties for these readmissions. And also, when we're having issues, we've heard most of the conversation today has been about security. So the data breaches on an annual basis is costing healthcare about $6.2 billion. About half of that is through criminal behavior. So the savings opportunity here is the hospital fines and readmissions decreased by $205 billion. That Medicare could stop their fining of hospitals for readmissions by $528 million, and that we could reduce breaches with medical grade connectivity by about $3.1 billion for a total of over $208 billion. So that's the opportunity of solving this problem. So we created a little model to show you the extent of this pervasiveness throughout the US. And what we found that if we approach this from a sequential perspective, looking at assumptions to establish a realistic addressable market, right? So how many people is this really? And so what we did was we looked at the percentage of chronically ill receiving clinical treatment, and then also the number of providers that said that if they could rely on a secure medical grade connectivity, and they could rely on the data coming back from remote patient monitoring, how many of them would actually not only adopt remote patient monitoring, but prescribe it to their patients as a standard of care. In healthcare, standard of care happens like a wave. A few people start experimenting on it. Studies are completed on it, like the ones I showed you with the $8,325 per individual per year savings. And then it begins to be published in our journals. And then, hey, if you're not doing it, you're the odd guy out. So that's what we mean when we say standard of care. So when we looked at the overall population, we decided to choose 2020 because we knew that tipping point for value-based reimbursement. And in the population, we divided it up by those people below 65 and those over 65 who had at least one chronic condition. So that led to about nearly 175 million people in the United States alone. So that's what, roughly half the population. And then we decided to lay some more statistics down, and we realized that of that population, 97% of those chronically ill were actually under the care of some clinician, and that the adoption rate by those providers would be 75% overall if they knew that they could rely on the data. So that would give us 175 million people that would be prescribed remote patient monitoring as part of their treatment plan for chronic conditions. Now add that to that is just per year, and most people are going to continue to use that remote patient monitoring year after year after year. So you begin to see the huge addressable market that is open to cable for this adoption of remote patient monitoring, and being able to give healthcare a trusted interface to run that on. So medical grade connectivity offers many opportunities beyond just the remote patient monitoring. So we just gave that as one use case for the numbers. So enhancing care delivery, like I shared with you, televideo capabilities, being able to really begin to share data from the home and the social situation back over to the healthcare system. Also looking at things like being able to communicate with that care coordinator and manager, having true consumer engagement with not just that patient, but their family, friends, and volunteers. Being able to share and distribute the right content at the right time. And also being able to, leverage different things like security solutions for the healthcare system. So in conclusion, as you can see, I'm a big proponent for the cable industry coming in and helping healthcare industry to solve major problems. And I'm really impressed with everyone who's in the room. The conversations have been just tremendous. I want to remind you the magnitude of the problem, just using one use case with remote patient monitoring on a secure, trusted infrastructure, and that was about $208 billion. Just think about when the healthcare system goes into this switch over to value-based reimbursement, they are now going to receive money to take care of an individual's life for that year from the payer, from the government. And if you think about that, you're going to be able to, through remote patient monitoring, save $8,000 to $12,000. You could actually come in and strategically partner with the healthcare system and really cause a tremendous amount of savings, but also be able to share in that savings as well. So there's a lot of interesting models that could be adopted moving forward in the next couple of years. And we're just talking, hard to tell you folks, but 2020 is only about 3 years away. So my name is Dr. Summer Knight. It's been great to spend a little bit of time on you. I hope you heard both my professional and my personal cry for support from the cable industry. We've been working with CableLabs and with some of your colleagues as well, and have been able to see real changes when the cable operators come and work to create a strategic relationship with the healthcare industry, and would be happy to talk with you out in the lobby anytime about that as well. So thank you very much. I have a few minutes. Did you want to ask, did you want any questions?
Yeah, we can do questions for about 5 minutes, I think. Dan, can you put any up?
And you don't have to send them in. You could just stand them up and shout them out. So that'd be great.
How's your son?
Oh, thank you. That's so kind of you to ask. He's halfway through the tough stuff, and he's all ready to take on. So his next staging is on the 17th of April, so on Monday. And we are sure that we decided that we have 0 and 100% for a prognosis, and we're going for 100%. So thank you for asking. That's very caring of you. You'll find I'm a big hugger. Thanks. Any other questions?
Do you think the restrictions on PHI is going to inhibit this type of social interaction and community interaction that you portrayed in the presentation?
Yeah, I know that it's an incredible barrier, but it's not an insurmountable barrier. So we actually took this on, and we piloted not the interaction with the healthcare system, quite at that to level, but we went to employers who really wanted to impact caregiving. And for employers, caregiving is a $50 billion issue. About 13 billion of that is on the 8% increase in health care cost of the caregiver due to stress as a caregiver, and the other $38 billion is loss of productivity and absenteeism. So we went to some of these large Fortune 500 employers and said, hey, if we could help you with your caregiving issues, are you interested in piloting in that? And they said, absolutely. So we did a great pilot with Capital One, and what they did was they didn't connect to the healthcare system, but what they did do is they put everything else on the consumer engagement platform. So what was going on? So and we ran my grandmother's scenario as well in parallel with that. So I'm going to use, because I can't use anyone else's, I'll still use ours. So for my grandmother, she's 95 years old. She lives alone at home, and she's got a great network of people who love and care for her. So what we did was we put her on this network, so all of her information was on, and what we did was give different, the administrator, which was the proxy, so for example, it would be my father for my grandmother's situation, could allow different people to have different levels of information, whether it was healthcare, financial, et cetera, on this consumer engagement platform, and then we were all able to communicate. So we see that in that employer market where, by the way, that employer is paying for the healthcare bill. So I think we're not far if we can put the right protocols in place So the technology is there. It's just putting the right protocols in place to also be able to have that connection into the healthcare system. So adding the tools of televideo, remote patient monitoring, adding that data in, and having that healthcare proxy give permission. So I think some states are playing around with some of those rules, and actually some healthcare systems. We were actually here with a healthcare system here in New York, and they said that they really wanted to start to address healthcare proxies to be able to engage the entire community for their diverse population. So great question. Ralph?
So self-insured corporations seems like they would be a great opportunity to try and push some of these issues, to your point.
Right.
How do you, beyond going one by one, how do you activate that?
Well, I think that that's a great question, and that's an issue of scale. I think right now we're still at the point of getting the momentum of understanding caregiver issues. So there's the patient issue, and then there's the caregiver issue, and so we've been able to impact the thinking around there. As a matter of fact, it was interesting at the CES conference that we went to last year was the first time that they actually talked about caregiver impacts and how you can use technology to impact that. So I think we're beginning to see the message on helping caregivers, and when you see the huge amount of dollars and you see the huge amount of impact to companies as well as individuals, then I think you start to roll that momentum in. And then healthcare systems want a piece of the action, right? So they're troubled by the fact that healthcare has moved from a local, regional relationship to all of a sudden a doc in the cloud can be seeing my patient, and that doctor could be 200 miles away, and then I never get the information back. So I think we're seeing an industry of the healthcare, and we're seeing the people who are paying for it and the employers kind of trying to figure out how do we come together and work together and create this community around the individual for care. And I think there's just a lot of work that needs to be done, but we're going to see that as employers adopt, and that they drive and require insurers that work for them to offer these types of solutions. I don't know if I hope I answered your question partially.
Talk a little bit more about Firecracker, what the organization does, Firecracker.
Well, I'll talk about it in the context of CableLabs. So CableLabs was wonderful to ask us to come, and we had done some work with some of your colleagues. So Firecracker International, we are a digital health services organization. So we try to help healthcare industry answer some big questions. So if they have issues, and I put them up on the board earlier around consumer engagement, around, hey, everything's moving to a virtual healthcare system. Help me to create a plug and play without having to, go tons of money out of pocket. How do we get better care triage and coordination? And so we source and distribute different platforms, look for best-in-class platforms for healthcare systems and for health plans to be able to empower all that. We also work with a lot of technology companies because, as you can imagine, if we're touching the client, they want to know, hey, how are you doing that? So we'd worked with one of your colleague organizations and helped them to as they were creating their strategy of entry into that healthcare market. And I believe we did a fairly good job because we were referred over to CableLabs then to help you all think about, should this industry really seriously think about getting into healthcare, considering that a number of the members were beginning to have forays. I mean, Cox has done their work with Trapalo, which we're really excited about. We were just talking about that as a partnership. So different organizations, and also for many of you, healthcare may be your largest customer, as an industry as well. So that helped. Any other questions? Yes.
You mentioned you were fighting with HIPAA. What kind of impact is that having on this holistic approach taken?
Yeah, I think, so now we're going to talk about personal and soapbox. I think HIPAA went out to do the right thing, right? It went out to protect us as individuals so that our healthcare issues would not become a hindrance to us receiving care or care coverage. Once that was enacted, though, very smart legal teams know how to write documents that patients sign that pretty much can help you somewhat circumvent and know what are the conditions. And now we've done a lot of legislation since then to make sure that people can get care coverage even if they have a predisposing condition. And so to me, there's in the HIPAA that HIPAA is causing a lot more barriers than helping any longer. And so, I think the spirit of HIPAA should be maintained, but I think the barriers that HIPAA is causing for us to all move forward in addressing these, bringing a community around the individual needs to be addressed as well. So, any other questions? It's been great to chat with everyone. Again, I'll be available in the back of the room or out in the lobby to chat with you individually. Thank you very much.